Well, if you've ever had an injury, then you know there's really nothing you want more than for it to heal so you can get back to your normal daily routine.
Lisa, there's really nothing worse than a nagging injury. I know you've had a few from CrossFit. I've had my fair share from just about every sport I've played. But fortunately, I've been lucky enough to have them heal on their own. Others aren't so lucky. For them, a physical therapist can be a lifesaver. But as I found out when I stopped by Coastal Physical Therapy and Sports Medicine, not all physical therapists are the same.
Anything with moving parts is bound to break down or need a tune-up at some point. Our bodies are no different. But instead of going to a mechanic to get us back into working order, we head to a physical therapist.
We have different groups of patients that actually come in, from pediatric to athletes to, just the average person on the street that, slipped and fell. You have some tendonitis in your elbow. Basically, therapy is designed to evaluate and treat what's going on with the patient and design a plan of care in order to get that person functioning the best quality that they possibly can. So we're going to do some box drills today.
Dr. Bill Bales has been working to get people back that function for the past 14 years. In 2008, he set out on his own and opened Coastal Physical Therapy and Sports Medicine to give his patients a more personalized experience.
Well, I had been in the field for a while, and I was very interested in a different kind of care that I was giving to my patients. I think that one of the biggest things is just making sure that the patient is an individual. They're not just a number. They're not a cookie cutter plan. When somebody comes in, everybody gets the same thing. That you can't treat that way. Slow down, and we're going to bring you back over to the table.
Dr. Bales takes a very hands-on approach in his treatment plans that he himself puts together after meeting with his patients.
A lot of it depends on the injury. When we have patients who are pre-op or have just hurt themselves, usually they come in with a diagnosis from a physician, and we're trying to figure out exactly what their deficit is, whether it's a strength deficit or range of motion deficit, and then designing a plan according to what their problem is to get them back to normal function.
Dr. Bales uses a variety of techniques to get back that normal function. He says he usually starts working to get a patient's range of motion back before moving on to strengthening the surrounding muscles. One of the tools he uses to do that is an indoor saltwater pool.
We use it primarily a lot more for back pain patients, but they don't tolerate a lot of land-based treatment. Even on the table, they don't tolerate a lot of exercises, but by getting them in the pool, it's 90 degrees. It's basically like putting a hot pack on your entire body. It warms up the joints. The actual water itself allows some resistance so that they can increase their strength. We can get them into the deep water where they're unloaded, and if they're having knee issues or back issues, we can unload the joints, get them doing cardio exercises to help reduce their weight if there might be a weight issue, to get some of that additional load off the body. But also, they might not tolerate walking a whole lot, so getting them out there, getting their joints moving, getting their heart rate up, keeping them a little bit more healthy than they would be out on land.
That pool also lets Dr. Bales perform different traction techniques.
Usually when somebody has a nerve root problem or a disc problem, the disc pushes out and pushes on the nerve, and it causes irritation to the nerve, and then the worse it is, the farther down the leg the pain travels. By doing traction either in the gym or in the pool, what it does is it actually separates the bones slightly. It helps suck the herniation or the disc back into the center, and it takes pressure off the nerve so that the nerve can relax, so that the symptoms start to centralize, which means that they come back to the center, which is what you want to see as they're getting better.
And whether it's in the pool or on dry ground, Dr. Bales says getting to know his patients and helping them get back to normal everyday life is his favorite part of the job.
Every person that walks in the door is completely different, and they have their own story. They have their own problems. They have, their own life issues. And, getting to know them and know their story, and just getting them back to functioning and getting them back to work to, provide for their family, or, just getting them back on the field is what I enjoy doing.
Now, Dr. Bale says it's important for people to remember that they have a choice when it comes to who their physical therapist is, so make sure you find one that you're comfortable with.
Absolutely. All right. Well, from an alternative form of physical therapy to an alternative form of physical activity. Coming up next, we hear about a group of women who are taking their fitness to the next level, literally. How these ladies are enjoying their treetop triceps.
Well, back here, down on the ground, there are plenty of fun exercise alternatives. Next, we hear about a few right here in our own community. Delmarva Life, we'll be right back.